What's it called?
Google autocorrect.
No.
Oh, Google autocomplete.
Welcome to Google.
I said the same thing. Google.
Okay. Welcome to Google Autocomplete.
Sorry, this is going to turn into one of those things. Okay, I got to get the laughs out.
This is Google Autocomplete at Naturopathic Specialists.
I'm Dr. Dan Rubin, and this is...
Dr. Mia Darling.
And we're here to entertain you. So let's not do a serious one. I mean,
Not
let's
at
be
all?
kind of fun
Okay.
for you guys. When, why naturopathic medicine?
When?
Did naturopathic medicine began? When did naturopathic medicine begin? That's a hard one. I think you probably know the historical texts better than I do.
You think so? But I
do.
really don't, so.
Well, I guess began at the beginning of humanity, when we had the first illness and healed ourselves by eating a food or drinking a water or not eating something that was toxic. Naturopathic medicine has its roots all the way back then.
Long before anything was patentable and put in a bottle. So all the traditional medicine men, acupuncturists, healers, it's been around for many, many centuries.
Okay, next entry. So why naturopathic medicine? Why do you think naturopathic medicine?
I think because it supports the person as a whole. It supports mental health, it supports emotional health, it supports nutrition and body systems and physiology dysfunctions. I think it's really looking at everything all together, which is a service to anybody.
It's so important, and it's the philosophy of naturopathic medicine which makes us different than other types of doctors out there. And why naturopathic medicine? Because naturopathic medicine works. Okay, why natural medicine is better? Well, I don't know that natural medicine is better. I think it's in the eyes of the consumer and in the eyes of the physician and what the situation is. I mean, certainly if somebody has an acute abdomen or needs an appendectomy, naturopathic medicine isn't going to be better for that. But I think we really need to qualify that. That's all I have to say about that one.
I think from a preventative point of view, it can really help to educate the person and to put them on the right track, whether they need a medication or whether they need a natural substance or whatever it is. But I think taking the time that we do as naturopathic physicians to educate the patient is a big part of it.
I agree, and that's why we like to work together, because we have the same philosophy.
That's right.
You want to? I'll pull it? Okay. Why, this is a long one, get ready. Why are naturopathic doctors' appointments so long? Because we like to find out as much as we can about the person, because that is what helps us get to what we would call the Tolle totem, or treating the whole person, or being able to prevent. I mean, for instance, it may take 45 minutes or an hour to distill the root of a problem and find out that perhaps something that is a behavior that somebody's doing or something they're eating may be the cause. Whereas if we don't take the time to look at that, gain the patient's trust and have them open up to us, we may never be able to promote and get to the healing.
I agree, and sometimes the patient can't always tell you right away what's going on with them, and it's a process of taking the time out with the patient to discuss where they're at and really putting the pieces together. So I think one of the things that I enjoy doing the most is putting together things like a puzzle. So if somebody comes in and they're experiencing certain problems, it's not just easy to put everything together very quickly. It's a matter of teasing out what those pieces are and putting them together in the right way to best help the patient to heal.
Yeah. Do you like puzzles?
Not so much,
Okay.
but I like people puzzles.
People puzzles. All right, last entry. Why? Here's another long one. Do naturopathic doctors focus on prevention? We don't want people to get sick.
And the patients that we have too, I think one of the things also is that we're very fortunate that we have very motivated patients who are very willing to make lifestyle changes and very excited and interested in knowing about their health. And that's one of the things that I enjoy, is when somebody comes in and they're excited to make lifestyle changes, and maybe they've been on the internet and they've Googled certain things and they've gotten way too much information and they don't know how to put it together. It's fun to be able to help them pull the best pieces of things that they found or things they haven't considered together into something that works for them.
And it can help deburden the medical system. It can help contain healthcare costs as well, and generally make people feel better. I agree. So for Google Autocomplete, this is Dan Rubin and Dr. Darling.
You got it. Welcome.
Okay.
Welcome to Google. Welcome to Google Autocomplete.
What's so funny? This is Google Autocomplete. There's nothing funny about it. It's a very serious matter. Give me the card.
Oh, stop. Should I do it?
Yeah.
Are we on? Are we live?
We're always live.
You edit this, right?
Nope.
Nope. Nope. It's all
What?
one.
Nope.
Yes.
Oh my God, don't do that. Oh, welcome to this episode of Naturopathic Medical Specialist Welcome to this episode of Naturopathic Medical Specialists.
No.
You can press back on your browser now, and it's just fine.